All right, so this video might take a little while. Let's do at least the first block of wrongs from the new free 120. Started off on the very first question we got wrong. They have a kid with kidney stones, and they want to confirm the kidney stones with CT abdomen pelvis. They're just going that that's the gold standard for detecting and localizing the uroteral stones. Their reasoning for ultrasound of the spinal column. I'm sorry. Their reasoning for why retrograde paleography is the wrong answer is because that's still just for helping you figure out what vesicoureteral reflux level that patient might have. Not so much just localizing the stones, which you can do with CT. Next was question 7. They want serum lipids in a 51-year-old lady. She has absent pedal pulses. This somewhat contradicts UWorld's evaluation of this patient. So typically, if you don't have pedal pulses, then you would need to do an ultrasound in order to determine whether or not those pulses are there or not. Whether the pulses are there, then you could just determine whether or not you want to do angiography and trying to revascularize the limb. And if it's not there, then it's likely that the limb is not salvageable. In this particular instance, they're just staying way more simple and just saying that dyslipidemia is a modifiable risk factor, and addressing that could address the significant morbidity proactively for this patient, which is interesting because you cannot proactively go after this person's peripheral arterial disease. They already have it. Next was number 10. It's saying that the lateral distal fibula is the posterior lateral malleolus. Remember, for the Ottawa ankle, you need tenderness on either the anterior or posterior portion of the lateral medialis. They don't explicitly say that, but they're telling you that it's the distal fibula. So then that's their reasoning on why that's the right answer. Next one is 12. They're saying that this 39-year-old has type 1 diabetes. This almost never happens like this. There was no precipitating injury. There was no precipitating illness. They just gave you the polyuria, polydipsia, losing weight, not understanding why. But in a patient who's 39, with that information, to just simply come to the conclusion that it must be type 1 diabetes is not sound medicine. For them to say that, I guess what they really wanted you to get at was that this person was already skinny, because their BMI ends up being like 18 or 19, and that it happened fairly acutely. It happened in like 6 weeks, and then that's why they're like, okay, well, this is truly diabetes type 1, but it just felt like the line was fairly blurred there. Understand their reasoning, though. Next one is 15. Ooh. No. Next one is 13. 13, they had you listen to the heart sounds. There were no sounds on the left lower sternal border and the apex of the heart. That's where the new murmurs would have been with the VST or a papillary muscle. If there was no murmur and quieter heart sounds on the left side, you need to insinuate that they have a left ventricular failure. They have basically another heart attack almost after having just had a heart attack 2 days before that. Not really that outlandish, but just didn't see it at the time, and it was just a little weird to get heart findings that didn't actually give you a murmur, or really anything that was super helpful. So the next one is a 1-week-old baby who has hypothyroidism, and they have you give them levothyroxine. It just felt like this was really soon, and their thyroid levels had been really switching a lot in a short amount of time. So it felt like too early to just put the kid on levothyroxine, a very difficult to dose drug, but that's what they wanted. It just had to increase TSH and decrease thyroxine. That's not the trick here. It's just that even in a 1-week-old, apparently that is something that's can be just a normal hypothyroidism type of finding. Next one was 27. That's the last one for this block. 27 we got wrong. It says that she has painful contractions, 2 to 3 minutes, and she's only 9 centimeters dilated. Um, and that was their like big reason on why you're not going to tell the patient to push because they aren't at 10 centimeters. So extremely nitpicky on their end. Um, but that's all they really want. I think they were saying that it was early D cells, if I'm remembering correctly. Nothing about that in the explanation, but I believe it was early D cells, and that was just from head compression, so there wasn't anything to do about it. All right, let's move on to block number two. First one we get wrong on block number two is question number 7. Okay, so this one was the person with depression, and the best option that they gave you was mirtazapine. It did say that he was having a hard time falling asleep, so that was supposed to be like an extra hint that that's what they want is mirtazapine for depression in somebody who's having a difficult time falling asleep. We used buspirone here. That's really just for generalized anxiety disorder. This person didn't really have generalized anxiety disorder, but I just wasn't really necessarily thinking about mirtazapine being a good call for this. The next one was question number 10 or 50 if you're doing the overall. This was a keloid, 100% knew it was a keloid. I think they had recently gotten their ears pierced. So you do corticosteroid injections for keloids. I did not know that, but it can happen from ear piercings. Uh, just says growth beyond the wound and association with trauma. Okay, that's not really earth-shattering news there. Okay, the next one was a 31-year-old who was slightly overweight, and they're saying what is going to help lower their odds of morbidity, and they went with DASH diet and the 31-year-old. So the hypertension was there, but there was no end organ damage. And so for this patient, they just needed the DASH diet. It emphasizes fruits, vegetables, whole grains, poultry, fish, and low diet, and has been shown to lower blood pressure. Should be advised before drug therapy in mild cases. I went with ACE inhibitor. I know that that actually has like verified more mortality, morbidity benefits, but it was supposed to be saved for stage 2 or at least stage 1 or at least stage 2 hypertension with evidence of end organ damage or other cardiovascular factors. So I guess this person just doesn't really have any other diseases except for a newly found hypertension type of situation. Okay, we're going to go ahead and pick up the rest of block 2 on another video.